name is Yolanda. I'm a student from Muskegon Community College. How are you today? Awesome. Well, I'm here to do an assessment on you. Basically, I'm just going to kind of put you in different positions just to see which position is more comfortable for you. My instructor is here watching. This should take no more than 15 minutes. And I'm also going to take you to therapy. So the physical therapy is waiting on you. And so as soon as we get done putting you into the various positions, I'll transfer you to your wheelchair and then we'll take you down to therapy. Does that sound okay? Good. So before we get started, can you please give me your name and date of birth? Awesome. Well, is the lighting okay for you? Okay. Do you have to go to the restroom or anything? Okay. Are you having any pain? Okay, good. So I'll go ahead and provide privacy, and then I will demonstrate the various positions. So the first position I want to call to your attention is the supine position. So my patient is currently laying in a supine position. Now I'm going to position my patient in a Fowler's position. So Fowler's is basically, there's various levels, and you can refer to your PowerPoint as to the various levels of putting your patient in a Fowler. So you have your low Fowlers, you'll have your mid Fowlers. So low Fowlers is probably about 30, maybe 35 degrees. And most beds now in the hospital, they have a little device that tell you where your patient's height is, the head of the bed height is. So you'll know if you're in a 35 or you're in 45 or you're in 90. So this is approximately 35. Under these beds here, these are pretty older beds. So, but if you look underneath, there's some numbers there, but these beds don't go any higher than 60. And the new beds go up to 90. So I'm gonna put my patient in about a 45. I say this is probably about a 45 degree. And then I'll go even higher to about 90. Okay, that's about a 90 there. That's the highest the bed can go. And most often when the patient is eating, if they're eating in bed, we want that patient to be at a 90 degree. Okay? So that is a Fowler position. So we did the supine, we did the Fowlers. Let's do lateral. Okay, so to position my patient in a lateral position, I am going to go back down, put the head back. This bed is kind of slow, it's kind of old. Go back to a flat position, and then I always raise the bed to a comfortable working height just to kind of save your back when you're working with patients, because it can get really uncomfortable if you're tall and the patient's bed is all the way down to the floor. However, before you leave, you want to make sure that your patient's bed is at its lowest position. But in the meantime, we're up at a comfortable position for me. I am going to position my patient in a lateral position, okay? So this side rail is up because you always want to make sure your side rails are up when you're leaving the side of the bed, okay? So I'm headed around to the other side. On the way over, I'm grabbing my pillows that I need, which I have them right here in the room. You want to make sure that you have all your supplies in your room with you, okay? So I have my 3 pillows so that I can position my patient, okay? As a matter of fact, I'm going to even raise this patient a little bit higher. So just a little bit more here. I'm going to raise. And then I'm going to make sure to put the side rail down. You always want to put the side rail down because you don't want to work over your side rail. Now it's kind of difficult working with mannequins because they're kind of stiff, but I'll do my best to show you how to turn a patient in a side lateral position. Okay, so what I'll do is, all right, I'll explain to my patient what I'm getting ready to do. I'm going to go ahead and pull you a little bit closer towards me here, just a little bit here. Want to keep them in alignment if you can, especially if they have a hip fracture of some sort. And then all I'm going to do is actually take these covers here and the pad and let it kind of work for me, and just basically push the patient over, okay, like so, okay. And then I'm going to take this pillow here and I'm going to position it right underneath the patient here, okay. So now the patient is off of their butts. If the patient has a wound and they need to be repositioned off of that wound, or they just got pressure, they can't really move. Like this patient does not move well at all, so they would probably have to be repositioned every 2 hours or so. So the patient is off of his right buttock, okay, pillow is underneath his neck, okay. I'm going to go to the other side, so I'm going to make sure that I pull up the bed rails, okay. Got my pillows heading over to the other side, okay. We have pressure points, and in the PowerPoint presentation you will see where all your patient's pressure points are, okay. The knees, the ankles, the hips, all those areas are pressure points. So we like to put pillow directly underneath your patient's knees to prevent that pressure on the mattress, okay. Then I want to make sure, remember we never work over their side rail. The patient's shoulders is a pressure point as well, so we want to kind of pull so that he's not laying directly on that shoulder. When you come to the practice test out, we'll show you how that goes to make sure that you have a clear understanding of that. So now our patient is comfortable, they're aligned, and they're at a lateral position. Okay, good. We're gonna watch the ears too, because the ears can break down too if they're laying on their ears. That's an area of pressure. Okay. So now I'm going back over here on the other side, and I'm going to put my patient in a Sims position. Okay. So to put our patient in a Sims position, I'm going to remove this pillow here. I'm going to not work on the side rail. Grab this pillow from underneath here. And this pillow can stay under there for right now. Okay? Maybe not. Let's take it off. We'll take that pillow out. Okay. So now I'm going to take my patient and pull him closer towards me, because I'm going to position him into a Sims position. Okay, so I kind of start behind the shoulder blades here, pull him closer to the edge, okay, get the lower part, half of him, pull him a little bit closer there, okay, and when you have a patient that's flaccid and can't really move, you get help. You always get help, because it makes it easier for you and the patient, okay, and so then you get the legs here, you move those over, and this hand, so as you can see, he has his hands here, one here, and he has the other one here. So this hand here I'm going to take and put underneath his butt, like, okay? Just like that. Uh-oh, leg fell out. Okay? So right underneath his butt there, okay? And now I'm going to take this hand here, so you're protecting the patient from falling over. If you need two, you get two. And then all I'm basically going to do is roll my patient over like so, just like that. Okay, and here's that arm was tucked under his butt. Turn his head to the side, okay, and then as you can see, you go this way, the knee is that way, and the patient is considered to be in a Sims position. Now this arm doesn't work too well, but we'll make it go here, and if it did, it would probably bend, and they would be really, really comfortable in that Sims position. Okay, so that's our Sims position there. Now, I'm going to have my patient go to prone. So from Sims, you might as well just go to prone position. So that's super easy there. All you do basically is have your patient straighten their leg out, like so. Okay. Hand is already down there. I'm going to put the side rail up. Go on the other side. Okay. And you can take it. You can have your patient. They'll be able to bend their arm. This is, like I say, this is kind of stiff. I'll put it down this way. Oops. There we go. And then we'll just take the arm and go here. And so now your patient is considered to be in a prone position. Flat on the belly, head to the side, and arms to both sides. It's like so. Okay? All right. So now I am going to turn my patient back over to supine. All right, let's turn my patient back over to supine. So I'm going to take this arm here. I'm going to give it a nice tuck underneath it there, right? And then I'm just basically going to have my patient roll over. If I got help or I need help, I get help. And then there's my patient back on his back. Okay? Patient too close to the edge, we go to the other side and we help to adjust this patient so that he would be in the middle of the bed, right? Not too close to the edge. Okay, so I'm going to move him over some, like so. Like that. And then I'll move his body over that way as well. Okay? So now, put a pillow behind his head to ensure that he is comfortable. So now we've done the lateral, we've done the sim, we've done the prone, and we've also done the supine. So now we're going to show you how we do trochanter rolls. So it's really important if your patient has an order to remain, hips to be in alignment. And so sometimes we can do an order for trochanter rolls to make sure that those hips stay in complete alignment. So that's fairly easy to do. You have your patient. You can put a bath blanket underneath your patient like I have here, and then roll from the side, or you can use a towel and roll from the side. I like the bath blanket method because it goes directly underneath them, making sure that you don't have any, bended areas, or just make sure it's nice and smooth so that you don't, the skin doesn't become at risk for breakdown because of the indentations. So you're just basically rolling this up underneath the hip to keep the hips in alignment. So just like that. So now the hip is kind of sitting on that roll there, okay? And you do the same thing for the other side. So that is the trochanter roll. Then you want to, I can show you some patients, when you get a chance to go into long-term care, or you may see it in the hospital setting as well, especially with the elderly generation, their hands starts to, from arthritis, sometimes become contracted, right? And so what we would like to do is prevent that from happening. And so most often what we'll do is we can roll a towel up like I'm doing here, or there are some other devices that come, they're actually trochanter rolls that you can put in the patient's hand and then Velcro it around. This can be very painful to a patient, especially if they contracted for a long time. So don't ever try to pry their hands open to get a roll in there. If the roll is too big, decrease it some. But the whole goal is to just make sure the hand doesn't go too contracted where it starts to cut into the skin of the patient. And I've seen that happen before. So you want to make sure that you take those trochanter rolls and place them in the hands like so, just so that the patient can, have that comfort or that grip without that contraction. If the patient is receiving physical therapy, they may be working on that, but this kind of prevents the hand from totally closing up from contractures, okay? So you put one in both hands of your patient to protect them, okay? So you'll see them just like that, okay? So those are your hand rolls. I've shown you your trochanter rolls. I showed you how to position the pillows. I will tell you that in hospitals, sometimes patients aren't able to move. And so we don't want our staff to get hurt, right? So we use various devices in preventing that from happening. One thing that we use is the friction. It's called a friction, reducing device. Friction reducing device. And what it is, it's kind of made of parachute material, that slippery material. You guys that work in long-term care, you probably have seen it. But it's really easy to use, and you just basically put it underneath the patient like a sheet, and then it just slides on each other like shoo, shoo. So if you wanted to, pull the patient, if the patient was too heavy or something was going on, you could use that slip to kind of zip, and it'll zip them up really fast and without any effort or pressure on your back to do that. So those are the friction devices that they have there. Some of them are yellow, some of them are green. They're all different colors. So you have those. Then you have the log roll. So log roll most often takes more than one person. So you can have 2 people, 3 people to help log roll the patient. So if a patient may had surgery, they have a hip fracture of some sort, we tend to want to log roll, or some spinal surgery, we want to log roll them. That means the whole entire body moves at one time as we roll. So what happens is we take the sheet, okay, so let's say we move here. I'm not going to be able to show you a accurate log roll in this video because it's just me, but when you get ready to come in for the practice test out, I'll show you with another person how to do an accurate log roll, okay? So basically, I'm just going to use this sheet. And a log roll is just what it says. It's just, you're going to roll up the sheet or the covers underneath that person in a log roll style. Or you can put a bath blanket underneath that person as well. And you're just going to roll it up like a log. Okay? I'm just going to use this. Literally, it's just like a log roll. You're rolling it up. Okay? You can use this part to help you too, patient's hand, and you just make it a nice, tight roll with your sheet. Okay? And sometimes patient has to go on the toilet, and this is how we have to, and they can't really move. This may be how we have to put them on there, on the bedpan of some sort. So person is down there, you may have 3 people here. So one person up here making sure that the upper body rolls at the same time as the middle body as well as the lower extremities. Everything all at once. So you're literally grabbing this, and it's going to, on a count of 3, 1, 2, and you're making sure that that whole entire body moves all at the same time. If this was a hip fracture, the patient would have a pillow or a fracture, it's like a little triangle device that they put in between the patient's legs to prevent those legs from crossing and ruining that hip surgery. So that's pretty much what a log roll is there. You could also Google it and YouTube it and everything else if you want to get a clearer picture on that. And maybe something in ATI as well. So, but that's how you do a log roll a patient. Okay? Now, the last thing we're going to do here is transfer this patient into the wheelchair. Okay? So, I am going to go with the wheelchair, which I have it right here. And I'm going to bring that wheelchair in here, as you can see. And I'm going to maybe turn it around. First of all, I gotta move some things around. And this is real life. This is how you have to maneuver your way through to make sure that you're safe and everything else, okay? So, I have my wheelchair here, as you can see. There is my wheelchair. I'm gonna push it back some. Now, if this patient had a, let's see, right hip fracture, I would make sure that I put the wheelchair on the hip, the opposite hip. So I don't want the patient transferring from the bed onto that hip into the chair. I want them to use their stronger side to transfer. It makes a lot more sense that way, okay? So if I'm the patient and I'm sitting down and I have to transfer, this hip is bad. I don't want this wheelchair on this side if this hip is bad. I do not, because it would be difficult for me to transfer into that chair with a hip that's bad or a foot that's bad. You literally are falling into the chair because of that hip. So you want to put it on the opposite side, okay? So that when I stand up, I'm standing up on that good leg and then if I'm able to stand, and then transferring into the wheelchair. So make sure you understand that, because that's going to be something that we're going to ask you, okay? So let's say this is the good leg now. The chair is in the right position. So when I go to stand up, I'm on the good leg to turn and to get into the wheelchair, okay? All right. But in this case, this guy's, both of his legs are bad. So what we would normally do is have two people to help transfer this gentleman. But it's just me. So, but I'm going to do the best that I can. All right. So I'm going to have to work very smart, and do things as if I was the only one there. Okay. So what I'm going to do first off is make sure I get all of these side rails off of the patient's wheelchair so I don't hit my shins. Okay. All right. Then what I'm going to do is I'm going to take this gait belt. Okay. You guys will have a gait belt in your packet. The gait belt that's in your packet is super simple. It basically, all you do is click it in. This is an old-fashioned gait belt. And I can show you how this big gait belt works. Very different from the others, from the one that you have. And all of them are different in different facilities. So it doesn't really, you'll just have to learn how to use it. But the biggest thing is that you have these teeth here, right? In this old-fashioned one. And so all I'm doing is putting this here, in between here, like so. And then as I step back, I'm putting it tight. So now for women, you want to make sure, because you're dealing with a lot of elderly patients and their boobs tend to kind of fall a little bit lower. Do not pinch their boobs. Be very careful. Have this belt a little bit further down so you don't have to worry about pinching their boobs, okay? You also want to assess, make sure they don't have any belly rings. People have belly rings. They have all kind of things on them. So you want to assess that before you tighten this up. And you want a nice tight. You want to be able only to get like maybe 1-2 fingers in there. So you want to get a good grip. And the purpose is if you're walking that patient or anything, you do not want that patient to fall, right? So you want to be able to have a good grip on them with this belt as they walk. And this here kind of helps with that support of them walking. Okay, so you have that on really tight, and then all you do is put it in the other hole, right? Super simple, just like that. Okay, just like that. Okay, so now it's on the patient, and then a lot of times you'll have all this left over. You can do a little tuck. Okay, and then now the patient is ready to be transferred to the wheelchair. Okay, but I'm going to be very smart right now because it's just me and this person who doesn't move very well, and I'm going to put this belt on him while he's laying down. Okay. All right. Take this trochanter roll out. I'm just going to put this behind him. Okay. And pull. And you really shouldn't be reaching on the other side of the patient. So I'm going to go on the other side. Always remembering to put my side rails up. Okay. And I'm going to go ahead and grab that part of the belt. And be careful, even if sometimes you may forget to take this belt off your patient. Once they get in bed, it's always easier to take it off when they're sitting up versus laying down, because it's just difficult. And then you don't want to pull it out really hard, because then you can cause your patient to have some burns on their back from the belt. So be careful with taking the belt off. Okay, so I'm just putting this belt on while the patient is laying down, just to protect me, because this patient will not, total flaccid patient. Okay, all right, so we got that on. It's nice and tight, just like I showed you guys. Okay, and you always, I'm going to put this up, you always want to make sure that your patient has something on their feet, right? You always want to make sure that your patient has their either shoes on or socks on, because they're at risk for a fall, and if they don't have anything that's gripping on the bottom of their feet, a lot of times they can't maintain their balance. If they're one person transfer, they have some type of weight bearing, you want to make sure that you have shoes or slippy socks on. So in this case, my patient has slippy socks. So I'm going to go ahead and transfer my patient to the wheelchair. So I'm going to put this down here. First of all, I'm going to lower the bed, because remember, the bed is kind of high. So I'm going to lower the bed to the lowest setting. Okay. All right, that's the lowest setting there. And then I'm going to go ahead and move the side rail. Okay. We're going to say that this is the strong leg here. So I'm going to move my patient just a little closer to me. It's a little easier. I have my wheelchair here. You can also raise the head of the bed up. That makes it a lot easier on you as well too. So I'm going to raise the head of the bed up a little bit. I can find the head of the bed. There we go. So the patient won't be coming from a supine position, and especially with a patient like this who needs help, you want to give yourself a good start. Okay? All right. So my patient is up a little bit. So now I'm going to put the patient's, protect the arms, the hands, make sure the chair is locked. Okay, my bed is locked. You always want to make sure your chair and bed is locked. I'm going to go ahead and take my patient and sit them up some first on count of 3. You tell your patient what you're getting ready to do. And then on a count of 3, I'm going to swing your legs around, okay? And then you put your hands underneath, and you just basically swing your patient around like that. Okay? Put your arm here. Okay, so patient is here. And again, if you have a patient that's totally flaccid, you're definitely going to be needing help. Okay? So my patient is here and ready to be transferred over to the wheelchair. So you tell your patient what you're getting ready to do, and we'll tell them on the count of 3, we're going to stand up and we'll transfer you over. You want to be careful, because sometimes the patient will want to grab the side of the chair. So you want to avoid that. Okay? Be in front of your patient, one knee in front of the other, and on the count of 3, we're going to stand up. 1, 2, 3. Stand your patient up, and then we're going to pivot. And then sit your patient in the chair, like so. Okay? So I don't know if you got that, but we'll definitely practice in the practice lab as well. All right? So your patient is in the wheelchair. Okay? We'll straighten his head out. Sit him up some. I like to go behind the patient, grab the gait belt, and lift him up some so he can sit up, like so. Okay? So now our patient is sitting up comfortably in his wheelchair. Okay? So then we take the gait belt off. He's going to go to therapy. Sometimes they like to keep the gait belt on. So maybe we'll keep the gait belt on for right now. Okay? What I do want to show you, we'll unlock here, is we do not want to push our patient down the hallway without his foot pedals. So I'll show you how to attach the foot pedals. Okay. All right. So here are the foot pedals. And you have these two holes here. Okay. And then you have the top here. All you do is make sure they line up, the holes line up with the groove, and then all you do is pop it in, just like that. You hear that pop, then you know that it's in. Okay. Make sure this is locked. And then you just take the patient's leg, and then it'll sit on top of that like so. Just like that. Okay. And now the patient is ready to go. All right, so once we are completed, let me straighten the patient out a little bit. His head is kind of funny acting, but patient is ready to go to therapy. We're gonna put both of them on. There's two of them. We'll put both of them on the patient, and then we'll begin, and we're ready to go take the patient to physical therapy. All right, thank you.